Hi everybody, it's Dr. Linda. Welcome to our August 2019 Facebook Live with world-renowned laser expert Dr. Stuart Nelson of the Beckman Laser Institute. Today we're here to answer any of your questions on vascular birthmarks, but primarily on laser treatment of all vascular birthmarks. Dr. Nelson runs the Beckman Laser Institute and is the VBF West Coast Medical Director. And you've been with VBF, what, 15 years now? 15 years. And we have a conference that is coming up on Saturday, October 12th, right here in Irvine. And the laser treatments and the clinic will be at the Beckman Laser Institute. So please, if you haven't signed up, sign up. Hi, Gabriela Castellanos. Happy to see you on. Hi, Aaron. Eskildilson, and the island will keep you safe. And hi, Amanda. We're ready to take your questions. And I'm getting some texts from April and Kristen on my phone. So hi, everybody. We're ready and able to take your questions. I'm waiting to see the questions pop up on my phone. I'm not seeing them yet, but we can get this scrolling over here. Dr. Nelson, remember this is not a touch screen, right?
Just roll it.
So I need to scroll it to go down. There we go.
You need to pull it.
Okay.
You need to drag it.
All right, I got it. So Alana, thank you. Our first question. Hi, my 2-year-old has a hemangioma close to the crease of her lip about the size of a mosquito bite. She was treated topically for 3 months, 1 year, and was on hemangiol from 1 year to 2 years. In the 1 year on hemangiol, she got sick with colds about 4 times, and each time had trouble breathing, always diagnosed with pneumonia. She's being treated for RAD, and her doctor thinks that if this keeps up, that she'll need a scope of her lungs. Is this common?
Well, I doubt it has much to do with her hemangioma, given the fact that she's now almost 2 years old. Some of the patients who've been put on oral propranolol, a beta blocker, have had problems with recurrent bronchospasm. But at least the reports that have been done in the literature with topical timolol have suggested that you really don't have that issue with topical ones. But with the hemangiol, it's possible, but it's probably unlikely. I think your child probably should be scoped just to make sure that there's no other problem which is leading to this. Some hemangiomas in the beard distribution can have problems in the subglottic area of the trachea, but an isolated hemangioma on the lip, that would be surprising that it would be causing all of those other problems.
Well, she also says that her pulmonologist didn't like the location of the hemangioma on the face, which I know it's typical of beard. So she said he thought there could be some internally, maybe meaning the airway, but a scope should reveal that, right?
A scope should reveal that. Mm-hmm. Usually we have the so-called rule of 5s, that when somebody has 5 skin lesions or obvious lesions, then there's a chance that there can be internal lesions. I mean, the lung is an unusual site. Usually we see those internal lesions on the liver, the spleen, or the kidneys. Mm-hmm. But I think for the sake of being thorough and to make sure that there isn't some other problem, some type of, bronchoscopy or at the minimum laryngoscopy should be done just to make sure that there's no other concurrent problem.
Okay, so I hope that answers your questions, Alana. Again, we are live today from the Beckman Laser Institute with Dr. Nelson. We still have time for patients to register for our conference here on Saturday, October 12th. You'll be able to get an expert opinion from Dr. Nelson, as well as Dr. Weiner, Dr. Hasso. Our 2 international doctors will be here, Tom Breeze and Coletti, and also many other physicians that we have here in California. Dr. Rosen from New York, our Sturge Weber expert, Dr. Comey and Dr. Pinto, and we have a cloves expert coming this year too. Doris Ortiz wants to know, can laser help reduce the size of the lip and the cheek?
Well, if there's already soft tissue hypertrophy present, it's unlikely that the laser is going to help reduce that. If you are able to treat an infant or a child before they develop the hypertrophy on the lip and the cheek, then I think you have a very good chance of preventing it. But if you've already got the soft tissue hypertrophy, the laser is probably not going to be as helpful at that point.
Okay, so thank you for that, Dr. Nelson. I'm just trying to move the scroller here. Yeah, I think that's it right now, and I'm waiting. Oh, there we go. So Jillian says her 4-year-old daughter has a large port wine stain covering her arm and back. They've done laser treatments every 3 to 4 months since age 1. Any new lasers or topical options coming out? We put her under GA because of hers being so large, and I just prefer to not do this forever. We've seen great progress on her upper arm and back.
Well, the first thing about that distribution, Jillian, I would be concerned that your child might have underlying Klippel-Trenaunay syndrome. So if not done already yet, your daughter should have a magnetic resonance angiogram of her entire involved extremity to make sure that there's no underlying Klippel-Trenaunay syndrome. Fortunately, with the newer versions of the pulse dye laser, the spot sizes are much larger. The repetition rate in terms of the number of pulses you can deliver in a second is much higher. So the amount of time that we have to put infants and young children under anesthesia is much shorter than it was just a couple of months ago because of the new technology.
Great. Thank you, Dr. Nelson. Okay, so I'm able to see them on my phone now too. Kristen's on. Hi, Kristen. So she'll see you at the conference soon in a couple months. So Allison says, what would a laser do to help treat my son's angiokeratoma circumscriptum on his right arm? It has grown and has become rougher and darker as he's gotten older. He's 5 now, no treatment to date, multiple yearly ultrasounds to make sure there's no muscle involvement.
I mean, the angiokeratomas don't respond very, very well to the pulse dye laser. There's just not enough blood inside those lesions to absorb the yellow light. If it is an issue, you can take a carbon dioxide or an erbium laser and you can actually vaporize away the angiokeratoma and flatten and smoothen it out. But you and your husband are going to have to decide, are you willing to accept the possible scar formation that might occur as a result of doing that?
But how about talking to her about the new study coming out where Venthera is looking for patients with angiokeratomas for their topical?
Well, that I wasn't. I thought they were primarily doing venous malformations.
Glomal venous angiokeratomas,
okay,
and yeah.
She can talk to the Venthera people at the conference.
If you're coming to our conference, Allison, we have a representative from Venthera. It's a biomed tech company that's created a topical drug that's now has clinical trial approval for treating superficial venous malformations, angiokeratomas, and glomal venous. If you can't come to our conference, please email me at vbfpresident@gmail.com. I will put you in touch with the rep to see if your son qualifies. I'm not sure of his age, but to see if he qualifies for treatment. Hi, Mentor. Mentor says hi to Dr. Nelson and Dr. Linda from Albania. I met you in Athens.
Yeah, I think if I remember you're the man that's in the Albanian military.
Yep.
And I treated your port wine stain, so hopefully the result was good.
Yeah, we hope you had a great result, Mentor. Jillian said they did do an ultrasound at birth and again at age 1 and said it looked normal, but we haven't done an MRI yet to check for KTS. Saw a dermatologist over the summer. I want an MRI done, but didn't think it was necessary. My husband also has KTS on his leg.
Well, there's been some suspicion that some of these may be hereditary or genetically linked.
Yep, genetically.
So without question, I would push to have your daughter's upper extremity, evaluated with an MRI with gadolinium contrast, so that they can be sure that there's no underlying KT. Because if there is, then there may be some procedures that the interventional radiologist can do to help facilitate the clearing of that port wine stain.
Correct. So Jillian said she agrees that she would want the MRI done to be sure. So Annie Lisi says her 3-year-old daughter has CMTC on her right leg. She wants to know if the laser is effective in reducing the intensity of color.
Well, we do CMTC, and in fact, I'm going to be doing a child on Friday from San Diego who has CMTC on the lower extremity. Generally, these lesions fade with the tincture of time, But if the parents are concerned, or if the child themselves has now become aware that they have that lesion on a cosmetically obvious area, then we'll proceed with the pulse dye laser treatment. But if your child is only just a couple of months old, you might want to wait a couple of months just to see if that will fade on its own.
Thank you. That was a good answer. I like that. Sarah says, is laser used when the hemangioma is raised, or is it only effective when flat?
Well, the pulse dye laser systems will only penetrate 2 to 3 millimeters into the skin. You can use longer wavelengths with the alexandrite and the ND-YAG, which can go 5 to 6 millimeters into the skin. But generally, the lasers, as well as the topical beta blockers, are most effective when the lesions are flat.
But what about using in combination? Would you get a little more if you did the topical
Well,
timolol with the laser?
We do that. I mean, it's
Yeah.
been synergistically demonstrated that the two work together, and at the time that patients are on oral propranolol was actually the best study that was done. It was shown that if you combine the laser with the beta blocker, you can reduce the time by 50% that the child needs to be on the beta blocker.
Wow.
And in fact, I just saw a child this week who had a left lower eyelid hemangioma. We referred them to the cardiologist, get the child on oral propranolol. And I think the child had her fourth treatment this week, and the lesion's almost gone.
That's unbelievable. I love to see that because
I'll show you the picture.
Yeah, that gives so much hope to families because they don't know about
Yes.
that combo option.
I mean, the family was telling me that the cardiologist wants to keep the infant on the drug for 6 months, and I told them hopefully we'll be done long before that. We can get the child off of it earlier.
This is why we do these Facebook Live sessions, because you're getting the latest information right here now and live from the experts. Hi, Phyllis. Phyllis is a 72-year-old with a port wine stain the right side of her face. It involves her upper gum. She's got to have tooth extraction and concerned about bleeding.
Well, that patient, we get this question very commonly. I mean, you may have a little bit more bleeding at the time this tooth extraction is done, but I would probably tell you, to speak with your internist, have a platelet count done, have a prothrombin and prothrombin time done, just to make sure that you don't have any abnormal clotting disease that might exacerbate that. But I think that you can safely proceed with the tooth extraction.
Great. And also at our conference, we do have an orthodontist.
Carol Fenn.
And it's a free service we offer. If you are interested in Phyllis in coming to our conference, you could get a free orthodontal exam. At least it's, a service that we offer. Unfortunately, we don't have our dentist this year. Hi, Donna Watson and Sarah. How are you? And thanks for joining us. Diane O'Callahan is on, and she says her port wine stain covering her right arm has lesions that have gotten staph infection in March and August, needling and antibiotics. I'm 67 and have had lesions since 30, but they usually heal on their own. Why staph? So it sounds like she's getting some...
Well, the question is, why are you having this undercurrent problem? I mean, if it involves your right arm, again,
KTS.
I would be suspicious that you have KTS.
Right.
You've got venous insufficiency, you've got lymphatic insufficiency of that extremity, and that's what's making you prone to these recurrent infections because of venous stasis. It's almost like a venous stasis ulcer or a venous stasis infection.
Right.
So you need a workup like that child does that we talked about. You need a magnetic resonance angiogram with gadolinium contrast to rule that out.
And also, Diane, if you came to our conference, by the way, it's free to come to our conference if you can't afford the very nominal fee. We have a few free hotel rooms left. You'll get a free clinic appointment with Dr. Delphinian and Dr. Rosen, and they are both experts, and they're experts in managing these so that you don't have the further breakdown and the ulcerations that can happen with KTS. And I'm really sorry you're going through those staph infections. It must be really grueling. You're welcome, Anne. So Robin Watson, she's on, and she says her 4-year-old has a 2.5-inch wide by 1/2 inch raised non-involuting congenital hemangioma, a niche, on his right flank. We were told excision is the option for treatment. We will get a second opinion, but is laser.
I mean, I think it's a little bit too thick at this point for the laser to be helpful, but I don't know whether I would go right ahead to excision. I mean, I think since it's not on a area which is going to interfere with the normal development of the face, for example, or in the anogenital region, I would probably wait a little bit and just see how this hemangioma plays out, the natural history.
Yeah, but it's a niche. They're non-involuting, and they
Yeah.
usually have a lot of redundant tissue. And actually, there's a study that just came out that they can recur in adulthood if they're not completely excised. That there's
Well,
some
I would
active
wait.
angioedema.
I would wait.
I mean, again, if you want, they can email one of our other experts. I mean, one of our extremity
I mean,
experts,
it certainly
like
can be
Dr.
excised
Rosen.
very easily. I mean,
Yeah.
for that size, it would not be a problem.
Yeah, I mean, I think what you're saying is there's no rush
There's certainly
at this
no rush.
age,
No rush.
but it shouldn't be left, is what I'm reading, because there's been some adults that are seeing recurrence of growth later in life from ones that have never been resected. I thought that was very interesting. Or possibly propranolol. No, that's
Too late for propranolol. Only
No,
works in the proliferative phase.
no, but propranolol is not used for niches. Only for infantile
or the
hemangioma.
proliferative phase, yeah.
Yeah, it's only used on an infantile hemangioma, not one of the tumors, not the niches or riches, right?
Yeah, and proliferating.
Right, and growing. So Heather, you attempted to get laser treatment, but for your toddler, he has a port wine, but he is biracial. Oh, and the doctor said that would make his skin lighter in the treated areas. That's not true if you have an expert, right?
Well, I saw a biracial child earlier this week, and they're going to come to Beckman for treatment, and they had treatment at some other facility, and the skin turned white. And the reason it turns white is because of the higher epidermal melanin concentration absorbs the yellow light. And so what happens is that the epidermal melanin layer goes away, but it will repigment normally. And now it may take several weeks to months for that to happen, but it certainly shouldn't preclude, having laser treatment. And in fact, I told the family that I saw on Monday, the best time to do the next laser treatment is when the skin is white, because there's no melanin interfering with the
when
absorption.
they're light, when they're
Yeah.
young, the youngest
Yeah.
they are before they fully pigment.
Yeah.
So
When
Heather,
they're white, do it white.
I don't know where you live, Heather, but let me know, because there's probably maybe a half a dozen that really work well with skin with pigment in it. A lot of
we
them.
can refer them to somebody.
Yeah, so we'll get you hooked up with someone, Heather, that's not afraid to do skin of color. Hi, Kyla Manny. Kyla Manny has 3 boys, and all 3 were born with hemangiomas. Isn't that something?
Family should be studied.
Yep. Kim Gordon just logged in. Hi, Kim. Her 22-month-old has been getting PDL since 6 months and is old enough now to really object to treatment. Of course he is. Is there any opportunity to use an oral med rather than a GA?
Well, I mean, the oral med that's most commonly used is Versed. Versed is an anxiolytic agent. It's also an amnesic. That can certainly help your child relax. The only problem with we use it is that because most of these procedures are so short, it takes a couple of hours, or at least an hour or two, for the child to really wake up. So if the procedure is only 5 minutes, then you've got the child in the recovery room because you've given them the Versed for 90 minutes. So that's a decision that you and your husband are going to have to make. You certainly could use Versed, especially if it's done in a hospital setting, not in an outpatient clinic. But just be aware that it may take an hour or two for your child to completely wake up, because that Versed has got to be metabolized after it's absorbed.
Good point. Hi, Casey, and hi, Elizabeth. One of our board members is on, Elizabeth Pry-Dishman. I'm just curious, what about when they do circumcisions? Do they give anesthesia or no?
No, it's done at the bedside.
Okay. You're welcome, Diane. So Carissa says her 3-year-old has had several lasers on his port wine on the left side of his upper body. He has it on the left side of his face as well, chest, arm, and back. The last laser he had made his port wine stain darker. Why would he get a result like this?
Well, I'm not sure whether the port wine stain is darker or whether he has what we call post-inflammatory hyperpigmentation, which means the epidermal melanin that we talked about will absorb the light, and sometimes those cells proliferate after the laser treatment's done, and you actually get the appearance that the skin actually does look darker. So I would wait a couple of months, and that PIH, which is the medical term for it, should calm down and go away on its own.
So Sarah said thank you, and she says she'll be meeting with you next month.
Okay.
Apparently she has an appointment with you, unless she means October at the conference. So Nicole Muse is on, Muse, And she says, are there any new treatments coming out for areas that PDL is not effective? What do you suggest for treatment of tough areas that may elongate the space between the nose and the lip?
Well, the newer versions of the pulse dye laser, as I've said, not only are the spot size is larger and the treatment time is faster, also there's more energy associated with those devices.
The Prima?
The Prima.
Prima.
We've only had it in 2.5 months, so we're gradually titrating up the energies to just do these treatments safely. So I would think that, I'm cautiously optimistic that over the next couple of months we'll start to see some improved results in those patients who sort of got to a plateau phase with the previous versions of the pulse dye laser.
So Robin has another question regarding the niche, and she said Boston Children's diagnosed it as a niche, so that's pretty.
The Boston Children's
Yeah.
people are very,
They
very
say
good.
it's a niche. It's a niche. She wants to know if it'll get any further, and the answer
We'll just
usually
have to
is
see
no.
with a tincture of time.
Yeah. I mean, typically they do not involute any further, but the patient gets bigger, so
Yeah.
then they appear smaller.
They feel smaller, and sometimes they just the body just
Absorbs
it, so
yeah.
you really don't need it
Right.
to have it done.
Okay, so Alana wants to know, can you do a quick overview of what the laser treatment looks like for a hemangioma? Small blip on face, how long is each session? Is the patient put under? What kind of doctor performs it?
Well, for the hemangioma, I just described a patient with a lower eyelid hemangioma that my nurse and I did on Monday. That procedure took less than 30 seconds. We had to put a contact lens into the orbit to protect the eye, but it's a procedure that can be done on an outpatient basis without anesthesia very, very easily, provided you have the appropriate ocular shields to protect the eye. But it's a simple procedure, less than 30 seconds.
Hi Dorothy, my friend Dorothy Kevlin's on. Thanks for joining us. Ashley Kramer wants to know her daughter has CMTC on her right leg. Can the laser help with that?
Yeah, well,
Must have missed the last
Yeah,
question.
we talked about that the laser can be very, very helpful if the lesion hasn't faded with time.
Nicole Muse again said, would you suggest a 3, almost 4-year-old attend the conference? Absolutely.
Yeah.
We have from newborns up to 80, 90 years old that come. We have the clinic sessions. You can get an appointment with Dr. Nelson, or if we suspect it's KTS or Sturge-Weber,
I
we'll
think
put
this is
you
a
in.
patient who's already in our practice, actually.
Oh, Nicole is?
Yeah, I think her child's name is Jackson.
Okay, well,
So,
she
yeah.
could still come
Yeah,
and meet
absolutely.
with other families and go attend the psychotherapy session, the group
Yeah.
counseling session. with
Congratulations
Leslie.
on the new baby, by the way, Nicole.
Well, see, he really does. You have such a good memory. Hi, Donna. So Donna's son, Ethan, had an extensive compounded superficial hemangioma involving his lip and chin, and he had numerous surgeries. He appears on our website in a lot of places. Both Dr. Wayner and Dr. Levitin did it. He's now 12 and has some pretty extensive scarring. Is there a laser that could help him smooth that out? He does.
Sure. We do this very commonly for infants and young children who had ulcerated hemangiomas, for example, or other complications. Procedures that we do for post-traumatic scars, burn scars, namely the fractional skin resurfacing. It depends on the type of scarring that you need to have treated. That will influence the device used. But if you can come to the conference, we could certainly talk to you about the treatment options for that.
They're in New York. They can,
Well,
they can go see Dr. Levitin or Dr. Wayner. They both have the laser.
I don't know. That I don't
they
know.
have
But Roy Geronimus,
well, Dr.
certainly.
Geronimus.
Certainly.
Donna, just email me. I'll get you fixed up with somebody. Even Dr. Williams can do it, Donna. Dr. Williams in Albany has the Fraxel laser in his cosmetic practice. But email me. So Chris and Maxie said thank you. So it's safe to continue like
Yep.
lasers. Okay. And how do we apply to get assistance? So you can come for free as long as you can get to our conference. You can get a free night lodging, breakfast and lunch is included, free conference admission, and free clinic. So if you can fly, drive, bus, train, whatever way you can get to the conference, then everything else is free, the free hotel for one night. Allison Maddox said, greetings from the Maddox family. Hello, guys. What can you share about the Prima? You just mentioned it if you want to mention
Well,
it.
it's still early. I mean, we've only had the device for 2.5 months. We're cautiously increasing the energy densities. The pulse structure of the laser is different than the previous V-beam laser, so it's not like all of a sudden we're going from an apple to an apple. There are some subtle differences, and it's going to take us some time to understand what the laser tissue interaction is and how we can gradually increase those energy densities safely.
Are you happy with the results you're seeing from
Yeah,
the
I mean, the
first
kids that we're
treatments?
treating now aggressively every 2 to 4 weeks, it's working very, very well. And some adults who have had refractory or dark purple port wine stains have also benefited.
I've seen some pictures posted on the Facebook after one treatment. I've been surprised. It looks like 2 or 3 treatments were done. I mean, I'm seeing, noticeable differences. So Savannah Mateen said, "Hi, Dr. Nelson. You treated her when she
Savannah
was a
Maiden.
baby."
Yeah.
Maiden.
The family moved to
Yeah.
Maryland, I think. Say hi to your parents for me.
Kim Gordon says, "Will the PicoSure,
Well,
P-I-C,
the PicoSure is not a
provide
device
better
that can be
results?"
used for a pulse dye laser. The PicoSure is used for the treatment of benign brown pigmented lesions as well as tattoos. So the PicoSure is not an appropriate laser to use for the treatment of a vascular birthmark.
Hi, Jeremy. Jeremy Hargrove joined us. Okay, and she said, "Yes, Jax." Okay, thank you. Okay, there's more information for Nicole on our conference, birthmark.org. Joan Brockenschmidt said her daughter has a port wine across the right side of her face.
She's coming to the
So-
conference. She's one of the ones we are going to do.
Okay, EMLA was used before. She'll see you in
Yep.
October. Do you use EMLA?
Yes, my staff will be in touch with you to make sure that your daughter comes in at an appropriate time. We'll put the EMLA cream on. I'm going to be in the operating room in the morning doing general anesthesia cases, and then we'll assign you a time to bring your daughter in, and we'll put the EMLA cream on. My nursing staff will do that.
Now, she said there's some stain inside the mouth. Will you do that or not?
Well, I have to see. We'll just, I
Yeah.
mean, I only saw the picture of the outside of
Right.
my mouth, so I don't
Right.
know.
You make the decision at that
Yeah.
time. Okay. So Chrissy Grasso says hi to me. Hi. Hi, Chrissy. Yes, we spoke last year about your youngest daughter and her mesenteric.
Mesenteric.
Yeah. it was-
That's interesting.
I know. I told her to send the case to Dr. Fishman, didn't I,
Yes.
Chrissy? Because they love these because they're so rare. So you noticed a blue mark by her eye growing. Okay, she was diagnosed with venous malformation. At this point, the doctor said he wanted to see her back in a year, but seemed hesitant to treat. So, okay.
Well, the treatment options depend on the extent of these venous malformations. I mean, certainly a laser procedure could be done around the eye safely with an ocular shield. The question is, how deep is that venous malformation? And, what did the imaging studies show? Because venous malformations can dissect between tissue planes, and they can be deep, and they can be up in the scalp and down the side of the face. So it would really depend on the extent of the venous malformation. That will really dictate the treatment options.
I wish you could come, Chrissy, and your 2 children, with a mesenteric hemangioma and then this venous malformation.
I'd like to see the imaging.
Yeah, because all of our doctors would be happy to see you at the clinic. We have, doctors from Europe coming, and Dr. Weiner, just a lot of great experts. Dr. Brakovich from the MGH. So Sarah says, a shout out to Dr. Nelson. We'll see you tomorrow. Okay.
Now,
So
Abigail is one of them we're treating with the Prima. So
Great.
Abigail's done very, very well. Last time I saw her, it was
So-
getting close to near the end, hopefully.
So please share some pictures with us, Sarah, if you don't mind, and that we can show other parents to provide some hope. If that's okay with you, please email them to me. So Judy Ham says she's 54 with 80% coverage, probably a port wine of the left face, and it's to the bone, is now getting blebs. What
Well,
can you do for
you can
blebs?
certainly use the ND-YAG laser wavelength of the Prima to flatten and smoothen out those nodules. We do it routinely. Roy Geronimus does it routinely. It's something that actually works very, very well and has been one of the really nice new features of the Prima laser. So I would recommend that can easily be treated on an outpatient basis with a topical anesthetic. Those blebs can be flattened and smoothened out.
So we're a half hour into our session. We only have 30 minutes more, but it's been a whirlwind. We've already had 56 comments, so it's a very, very busy session today. But I just want to let you all know we only have 30 minutes left. Lita Anderson says hello.
Hi.
Nancy Hamilton Brick says for Port Brit says for facial port wine stains, especially on the upper lip, some people have no asymmetry, some do. Is this lymphatic or is this venous? Like,
No, it's due to the fact that because there's increased blood flow in that area, you get an hypertrophy or enlargement of the underlying soft tissues, and in some cases even muscle and bone. So it really doesn't have to do with the lymphatics. And you asked about the prima. If anything, the patients and their families are telling me they're getting more swelling as a result of the prima. So what we've been doing is trying to ice down in the OR infants and young children who are being done under anesthesia, or immediately ice down the patient in our clinic right after I finish the laser treatment to help mitigate that.
That's good to let the parents know, because if they're not doing it, maybe they can bring their little coolers with their little ice packs and
we
do it themselves.
We do it routinely. In fact,
You
I
do, but
yeah. In fact, Sarah Lackey, she emailed me the next day because I was so aggressive with the ice. Her child's face was red even the next day, and she said to me, "Why was this from the laser?" And I said, "No, it was actually from the ice because we're using high energies."
Well, you'll find that balance.
Yeah.
Okay, so Charmaine Jefferson says, once a baby has had wonderful clearance after 7, will the skin darken again over time?
So where are you reading?
Charmaine Jefferson, right here.
Okay.
So it's port wine stain.
Well, it is possible if there are residual blood vessels that were not treated by the pulse dye laser currently. If there are some residual blood vessels deeper in the skin, slowly over time they may grow up to the skin surface, and you may see some recurrence. But usually when we see that, it's very easily to start retreatment, and we can usually get that patient back to where they were before you saw the recurrence.
Great. Ruby Garduna Hamilton says, hi, so very glad I made it. Baby Blakely Grace was just born on June 1st in England. Congrats. Her daughter is American, has had subglottic hemangioma and hemangioma on her nose, has ulcerated. Some complications, breathing too, swelling of the face, and started on propranolol. For 3 weeks, she was taken off without wing off. Oh, waning. They didn't wane it. Weaning or waning it off. Yeah.
Waning.
Yeah.
I mean, I'm a little bit surprised that they took the propranolol away so quickly.
Well, maybe there's another comorbidity, something else going on.
Well, that I don't know. But usually the rule of thumb, generally and by convention, is that you wean a child off of propranolol for 25% of the time that they were on it. So to make the math easy, if a child was on propranolol for 4 months, it's going to take 1 month for you to gradually withdraw that propranolol so they don't get a rebound tachycardia or hypotension or low blood pressure.
So if they've been on it for 2 years, it's going to take
6 months.
6 months.
6 months.
I was just going to say that. That's why they're rebounding. They're not giving them a slow enough taper. I've been saying that all along.
You have to taper it, otherwise.
But if you use that ratio, is that published?
Well, that's what we've been doing. That's what we've been doing with our colleagues at the Children's Hospital of Orange County. Now, there have been some, consensus papers that have been published by some of the pediatric dermatologists, like Beth Drolette. That's a good question to ask her at the conference. She's been one of those people that's put these consensus papers together that have, we've been basically following that usually it's, 25% of the time should be weaned the amount of time that the child was on the drug.
And that's not in the AAP guidelines, because they say they just have a flat 3 to 6 wean time. So that could be why we're seeing a lot of rebounds.
25%. 25%.
I want to follow up on that. So Kendra says, hi, Dr. Nelson. Kendra Contreras.
Yeah, they're from. I met them at the conference in New York last year, and they came to Beckman.
She'll see you for another treatment. They've been happy with his progress.
Say hi to Lawrence for me.
Carney Broadbent said, hi to both of you. My son is 4 months, has port wine over his whole face and most of his skull. Does laser hinder hair growth if treating the skull or eyebrows? Is there a difference between the effect the laser has on a baby child compared to an adult?
Well, we're not going to be treating the skull. We're going to be treating the scalp. But usually I don't treat those areas. And the reason is because
hair-bearing areas.
The hair-bearing areas is because their melanin, which is in the skin, is also in the hair shaft. And so the yellow light will be absorbed, and it has a pulse duration that is long enough to actually destroy hair follicles. And in large series that have been done, there's about a 20% chance that if you treat somewhere in the scalp, you can actually reduce the amount of hair follicles, and you can actually lead to alopecia or baldness in those areas. When I'm working around the eyebrow, I try and stay away from the eyebrow. I let the parents decide whether or not they're willing to accept that 20% chance that you may get some permanent hair removal as a result of doing these treatments in the hair-bearing areas.
It's really important information. So Charmaine says, at what age do you recommend using the numbing cream too? But I mean, that's all dependent on the child.
Well, it
right?
depends on the surface area involved. It depends on the age of the child, the weight of the child. Generally, we won't use it in anybody less than at least 1 or 2 years. There has been described this phenomenon of methemoglobinemia, which can occur if it's almost like a lidocaine toxicity, and it's a medical emergency. And so you have to be careful using large amounts of topical anesthetics in infants and young children. There actually have been some reports of deaths in patients who had laser-assisted hair removal who had the topical lidocaine put over their entire back, for example. So
that was an adult.
That was adult over a large surface area.
Right.
So still, I don't like to use it in kids that are less than 2 years old.
And at the conference in Greece, that's what happened. Remember, we were told no EMLA on any of the little babies for that reason. You were just lasering without the EMLA. Dr. Geronimus was saying the same thing. That's very important for parents to know that. Mavis just said, thank you, you are very welcome. She doesn't know how she would have dealt with it if it wasn't for the foundation. Thank you so much. That's why we're here, everybody. Hi, Erin Cully Klein and Carrie Hargrove. Yep, you are very welcome. Julie Moss just joined us. Jacqueline Nicole. Her daughter has a full right arm, hand, full left leg, foot, chest, back, and buttocks and lower back, port wine. Currently treating every 2 weeks, alternating between arm, leg, and foot and leg.
Okay, well, then that extensive lesion, I hope that there has been some workup to make sure, again, there's no underlying Klippel-Trenaunay syndrome. That extensive a lesion, I would be concerned that your child has underlying KTS, and they should be studied.
She wants to know if, she also asked another question, is she jeopardizing not seeing better results by not treating the other areas yet?
No, I think what you're doing, every 2 to 4 weeks is reasonable. That's very reasonable.
And then certain areas at a time is okay?
Yeah.
It's not hurting anything.
It's not hurting anything, but your child needs some imaging studies, Jacqueline.
And what about if she went for one area to be treated? Couldn't they do a little spot size on the others and just see how it would respond?
I mean, even if the child is an infant, I don't remember seeing how old this child is, but you can, with a new
daughter. She just says daughter.
You can treat almost an entire extremity in 5-10 minutes, which we just couldn't do before.
True, that's right, because with the what is it, 25% larger spot size?
Yeah.
So that means you're
Plus,
getting,
the repetition rate is now 1.5 hertz, so it's 50% faster.
Oh, so you're getting 50% more space and faster?
Faster, yes.
Wow. So what does that calculate to be? That a normal treatment that was done in
you're
3
reducing
minutes?
the treatment times by half almost now.
Wow, I did not know that.
Most of the kids, because they're facial lesions, it doesn't really make a difference. But when you're doing an extremity,
that
it really makes a huge difference.
That's huge. So George Lamplota said, is Deprima used throughout the U.S. or just in New York? No, it's doctors. I know doctors in Texas that have it, Florida. Quite a few now have it in the U.S.
There's 30 or 40 of them in the United States as of a month or two ago when I spoke to one of the Candela representatives.
And you can go on
Denver,
the actual
Colorado.
Candela Syneron website, and there's a link to providers on there. If you can't find it, George, email me and I'll email my contact at Candela and find out in your state who has it. So just email me. And my email is here. The staff are posting it. Hi, Joy Rose. She's going for a consult in a few weeks in Canada. Port wine on the cheek. If you treat as a child, do you need to treat as an adult?
Well, hopefully we're now done by one, trying to do as many treatments as possible in infants and young children. So you might. I mean, there's no guarantees that even if it's gone completely, that it might not come back a little bit later on. So that's a difficult question to answer.
Yeah.
You'll just have to wait.
Nobody knows, right? No
knows.
2 port wine stains are alike. Jacqueline says also, we did do an ultrasound and make sure there was no tethered cord, but our doctor doesn't think she has KTS, but we haven't done any other imagery. You can email for, go right on birthmark.org and you'll see Dr. Kami Delphinian. He's our KTS expert, and you can email him for a free opinion on that. I mean, because we're not usually looking at tethered cords with a suspicion of KTS,
Well, but I think it's just because there's a vascular birthmark
Right.
over the spine.
And
the
that's
incidence is
true.
low.
That's true.
I mean, it's 5% or something
Right.
like that.
Less
But I mean,
than
it was
5.
good that they did that. But I
Yeah.
think that you should have further imaging studies to rule out underlying
Oh, so
KT.
Jacqueline said she's almost a year old.
Yeah, okay.
So Joy Rose says, thank you for volunteering your time to us parents. You're very welcome. Sarah Zan wants to know, what age do you start laser for a hemangioma? My daughter has one above her lip and has been on propranolol since she was 6 weeks. She's now 5 months.
We start right away. I mean, that child with the lower eyelid hemangioma I was talking about, I think the first treatment we did at 2 weeks.
So
So, right away.
Yeah, so you can send your picture to Dr. Nelson to
right
look
away.
at, because it does depend on the size,
Yeah, and
the
thickness,
depth,
the thickness. The thickness is more important.
You're saying the laser is 2 to 4 mils, so I mean, like I always tell the parents to put a dime on the side of a table. That's like about 2 mil. So think about that. If it's puffier than like a dime or a nickel even, it's not going to get much, right? I mean,
No.
you can get a little, but you can get a test done of it. Wow, so we've done 76 comments and questions so far. We are 20 minutes left. Again, waiting for the next question to come in. George, okay, yeah, she's just providing my email for George, vbfpresident@gmail.com. Once again, we're only 6 weeks away from our conference here. This is our sixth one, isn't it?
I think it's at least our sixth in
Sixth
Irvine.
here, and it starts off our 25th anniversary celebration.
Yep.
So we start this year and go all the way through till October of next year, where we finish it in New York. 25 years of VBF networking families into treatment, providing our international physician education through the I-team, and all of our support that we provide, free lasers and consultations at our conferences. So if you're still listening, if you're on now and listening, we still have openings for free hotel rooms, free clinic appointments at birthmark.org/conference. And it is right here at the Beckman Laser Institute and at the Hotel Irvine will be our conference on Saturday, October 12th. All day here, Saturday, October 12th. Rachel, hi Rachel. So she says thank you to Dr. Linda and Dr. Nelson. Evan says hi. That's Rachel Perche Lane.
That's Evan Lane from Dallas, Texas.
Oh, okay. Hello.
Big Cowboy fan.
Joy Rose says, don't you ever come to Canada.
I was born in Canada.
And where's ISFA?
I went to, but actually ISFA next year is in my hometown in Vancouver,
So,
at the Bay Shore Inn. So right next to Stanley Park in May. So come
maybe,
to,
what we could do, maybe we could do an informal clinic and then we could post it.
Sure.
And you could see some patients while we're in Vancouver.
Absolutely.
Email me, Joy Rose, so that I can look into arranging for Dr. Nelson to see some patients there. Hi Kim, so she thinks Facebook is zapping her questions because of the anatomy term of child. No, they don't zap for that, I don't think. So you mentioned AG, bottom region, just now, and a port wine stain that runs buttocks to sole on left side and wraps to the groin. Should it be applied to the, I guess she means to the groin region, in addition to the buttocks?
Sure, I treat those areas. There's absolutely no reason not to. But again, that port wine stain should be worked up for Klippel-Trenaunay syndrome.
Right. That's the most important thing, because then there's management that comes into play. Jeremy Hargrove says, Reese says hi.
Say hi to your sister Paisley.
And Joy said, okay, we already got that. Trying to get this next one. Let me
So Eastern Canada, Joy Rose, you can easily get down to Roy Geronimus in New York from Halifax. I think Air Canada has flights to New York, so you can easily go down and see Roy. And
we have the VBF discounted rate, flat fee of $500 that Dr. Geronimus does. No matter how big or how small the spot is, he has a flat VBF rate. You contact me if you decide to go to see Dr. Geronimus, anyone. and I submit your name for approval for the VBF flat fee of $500, and that's each session, no matter how small or big in area. Okay, George, not sure if you're willing to travel, but the dermatology clinic at the University of Wisconsin has the Prima. Oh, that's another family providing that info for you. That's okay, Joy Rose. Hi, Ann McCarthy from Trinidad. Kiana's mom is on. She recently, I think, had a birthday, right? Happy belated birthday, Ann. So we're at 88. This is like huge for us. I think we could make 100. That would be really a big deal for us. Because we have, how many minutes left? 15 minutes left, everyone.
15 minutes.
So 15 minutes, still accepting your questions. By the way, if you're just tuning in, hi Kim again about KTF. Orthopedics order genetic testing. Well, they're looking for that PIK3,
mutation.
The PIK3 mutation. It just tells you if you have the mutation, but the key is if you do have the KTS to get to a management expert.
Yeah.
Because there's water therapy you can do, compression garments.
Interventional radiology perhaps can be helpful.
Yeah. And sometimes they need wound care, laser. So there's a lot, if it does come back to KTS, that would apply to you that doesn't apply to a typical port wine stain. KTS is Klippel-Trenaunay syndrome. It's a triad of a port wine stain, so that's superficial. The stain, some say it's not really a port wine stain, but it's a superficial stain.
The vascular malformation of the skin.
Right, and it can also involve tissue overgrowth and bone.
Yes,
so
you
that's
can have venous
triad.
insufficiency,
Right.
lymphatic insufficiency.
Right.
So that's why for a lot of the people who've been talking about lesions that involve a buttocks or chest and then an entire extremity,
hand,
those patients really do need to be worked up for Klippel-Trenaunay syndrome.
And patients who have a port wine stain that involves an upper or lower eyelid should be worked up for Sturge-Weber syndrome.
And glaucoma.
And glaucoma. So Amanda Wingert said, if imaging showed a vascular malformation, deep tissue, should there be concern even if it does not show physically, though in his leg was SPDVT 23?
Status quo deep vein thrombosis.
FAVA.
Yeah,
So that could be FAVA, right?
And it also could be
fibroadipose vascular anomaly.
Or sometimes even KT patients are getting deep vein thrombosis. There's a group of people that think they should be on prophylactic aspirin.
Again, Amanda, if you could come to our conference where Dr. Delphinian and Dr. Rosen will be, extremity experts will be here, free clinic, even if you can just get to the clinic. Otherwise, you can go through our website at birthmark.org and ask Dr. Delphinian and Dr. Rosen or both of them a question. Connie also wants to know, just a follow-up about the hair. If the scalp and eyebrows aren't treated, what happens? If it starts to thicken, then...
Well, then you take your ND YAG laser and you focus just down on those vascular nodules and treat them individually, as opposed to treating large surface areas, which could lead to, very obvious alopecia.
Now, if there are blebs, though, or some tissue hypertrophy, what about if they did surgery?
Yeah, you could. You could certainly, if the area's not too big, you could excise them.
Yeah.
But I mean, just a pulse or two of the YAG laser, if it's small enough, is the easiest way to go.
Right.
But certainly it could be surgically excised. The scalp can have a tissue expander. It heals well because it's so vascular. So that surgical, is an option.
It's an option. Robin says she's 63 years old. She has a port wine on her leg. Dr. Weiner has treated me for years. He hasn't mentioned the new laser. Do you think it is better than the pulse dye? Yes. Or the YAG?
Well, the new Prima laser actually is a pulse dye and a YAG laser. That's
combined.
What's unique about it. It's actually in the same laser device.
I thought he did have it, Robin. He's moved, or he has kind of a new practice now. I don't know when the last time was you spoke to him, but in May, I think it is, he switched over to the new laser. Now, if he doesn't have it, he probably will be getting it, but Dr. Geronimus has it in New York City, and you can get the VBF flat fee rate I just mentioned of $500 per treatment, no matter how big or small it is. So if you want a treatment with the PDL in New York, you can see Dr. Geronimus, the Prima. You can see Dr. Geronimus. You'll have to email me at vbfpresident@gmail.com to get you on that list approved by Dr. G, unless you have an insurance that he accepts. But I'm just saying it's an option if Dr. Weiner doesn't have the Prima yet and you'd like to try it, because I'm hearing some extremities are responding to the Prima that weren't responding to a traditional PDL from some people. Ruby Garduna Hamilton again, she's saying sorry. She types so fast. Would love to write with my granddaughters, so she is having stridor without the O2 stars, dropping blood pressure low, swell of eyes and face. Okay.
Well, if she's having stridor with her hemangioma, she needs to have a laryngoscopy and have a pediatric otorhinolaryngologist, check her vocal cords. The classic location is just underneath the cords. It's called the subglottic area, and that's a medical emergency, so that should be done promptly.
ASAP, and I don't know where you live, Ruby, but if you're in the New York City area, Dr. Levitin will email you immediately and get seen. But the thing is, they have to see an ENT that knows what they're looking for.
It should be done.
Because we've had these patients go to the ER with these, and they don't know to look for a hemangioma in the airway. Actually, Ruby, email me right away, and as soon as I get off of here, but email me or post on here where you live, Ruby, or where the baby is, I should say, your granddaughter lives, so that I can get some contact information for you tonight for someone that they can immediately contact to check the baby's airway, because it is important. Dr. Nelson says it could be a medical emergency.
It can be.
I know.
Sometimes we've had to do emergency tracheostomy, so it can be.
Marianne Esquizel says,
Ezequiel. I think this is a family in Florida.
About the Clarity 2 laser with VivoSight.
Well, the Clarity 2 laser, I think, is a device that's being made by Lutronic. I think it's a combined Alexandrite and ND YAG laser. I don't think it has a pulse dye laser.
Okay.
The VivoSight people have been talking about. Years ago, we actually published a paper using imaging of blood vessels using optical coherence tomography. So we have looked at this in the past. The problem is that you can't image deep enough with these optical coherence tomography technologies at the present time to really see the deep plexus of blood vessels within the skin. So we have done some imaging. There is a new device that the company is, advertising for this, but how successful it actually can resolve very small blood vessels in the skin, I think, is still a little bit open to question.
Thank you for that information. I didn't know that either. So we only have 8 minutes left. Gloria said, thanks for the info on the Premier. See a Dr. Suzanne Kilmer in my future. Not sure who that is.
She's a dermatologist in Sacramento, very good friend of mine.
Okay. So
highly qualified.
Great. Another person we can get on our list that you think is qualified is good enough for me. Sydney Lopez says she was diagnosed with KTS when 7. Doctor said to wear compression.
Good.
Yeah. When I was 24, I went to the vascular doctor. She said I had CIV and reflux in my veins on the right side of my leg and reflux in the upper right side. I have a very dark port wine. I understand with compression this will help, but in the long run, what do I expect?
Well, I think if you've got reflux as a result of your KT, you should be evaluated by an interventional radiologist. Now, here at Irvine, my colleague, Dr. Kari Nelson, who was no relation to me, they can do procedures to stop that reflux and obliterate that type of a condition. So I would, if you can, come to the conference and see Kari Nelson and Bob Rosen and get an opinion, because that can certainly be treated by interventional radiologists.
Thank you. So Chrissy has an interesting question. She's the one with the mesenteric hemangioma child, and she was saying she doesn't think it's connected, but the child has an elevated lactic acid level. I mean, I wouldn't rule anything out.
That I'm not aware of that. I'm not aware of that.
You could talk to Dr. Fishman. I thought I had given you his email. I don't know if you've asked him, but I would. God bless, been very scary. Yeah, that's for the grandmother. So Joy Rose said, Ruby, we had the subglottic found with scope.
Good.
Yeah, thank you for sharing that, Joy
It's almost
Rose.
90% blocked. It's a medical emergency.
Yeah, 90% blocked. Thank God. George says, are the results better on the face as well with the Prima laser or just extremities? Our son's birthmark has not been much clearing. Just wondering if we should try to get the new laser. Yeah,
absolutely.
Yes.
I mean, the
Yes.
Prima should work very, very well on the face. Better than the extremities.
Okay, so we're coming down the finish line, only less than 6 minutes. Emma Hill says, has there ever been a link with cancer in mother of a baby with a deep hemangioma? I was diagnosed with breast cancer when my baby was 5 months old. I've never heard of it in 25 years.
That I am not aware of any association like that.
Yeah, I've not heard of it in 25 years. I mean, and we've been through 125,000 have been networked into treatment, but we've communicated with several 100,000. It may be just an unfortunate statistical probability. So I'm so sorry, Emma. Yeah, I hope that everything's okay for you. So we are less than, well, we're coming up on 5 minutes left. Once again, before I sign off, our conference is on Saturday, October 12th, right here at the Beckman Laser Institute. We still have openings. It's at birthmark.org/conference. You can read all about it. You can see all the speakers and the clinic teams. I personally assign everyone to make sure you see every doctor that you need to see. We typically have about 125 clinic appointments. I believe we have 2 spaces left for the Freeport laser treatment.
I think
you said one left for the free laser, and first come first serve, right? Whoever signs up for it gets that one, last one. Oh, okay, yeah. So in Florida, that has the Prima 1000. I don't know who has it, Marianne, in Florida yet.
Maybe Anna Duarte. I don't know.
She might have it.
Don't know.
She might. So Dr. Duarte is on the front page of our website on Ask the Expert. She's at the Nicholas Children's Hospital, but she does treat adults, Marianne. So if you want, you can email her directly through VBF and ask her if she has the Prima laser. Hi, Linda Thomas. She's just joined. So we have, okay, we're down to a little less than 4 minutes. For Dr. Nelson, and we hit 109.
You got your 100.
So we've got over 100. So this has been a very successful, very busy. But I was just saying before we started that Dr. Nelson holds the highest number of views over a laser or a session that we did a year ago. It was July of 2018. Is now up to almost 14,000 views.
Good.
So these become available from January of 2017. Until now, I've been doing Facebook Live with an expert once a month. We keep them on our Facebook page. They're on our website at birthmark.org, and they're on our YouTube channel. And you can click on the YouTube link at the top of our page and re-watch these as many times as you want in case you've missed something that Dr. Nelson has said, or if you meet somebody on one of the 59 Facebook groups that I'm a part of regarding vascular birthmarks on Facebook, make sure you let them know to like us on Facebook. You have to like our page, but that, in other words, to see it, you have to like us on the Facebook page.
Okay.
So you hit the like button on Facebook, and then that gives you access to all the videos, or you can go to our VBF birthmark.org page. So we are down to 2.5 minutes. We are still taking some questions. Oh, so Diane wants to know if there's anybody in New Hampshire. I don't know anyone, Diane, but I do know Dr. Geronimus is in New York City.
Well, New Hampshire, whenever I was going to New Hampshire, I always flew into Boston. So just go down to Boston and you can see at the Mass General.
Yeah, Dr. Anderson.
Rox Anderson.
Or Dr. Cohen is in Connecticut at the John Hopkins. That's not that far either, right? So.
Sandy Sau also
Dr.
at Mass
Sau.
General.
So
Matthew Avram at Mass General. So
yeah.
There's plenty of people very, very close to you.
So the if you Google vascular anomalies program at the Massachusetts General Hospital, you'll find out, or if you email me, I'll just give you that information, Diane. But not in New Hampshire, but we do have at John Hopkins and in Boston really good people who probably all have that. Do you have the Prima? Yes, Dr. Nelson
absolutely.
does have it.
If your husband is still piloting aircraft and you're willing to fly out, I'd be happy to see your son.
Oh, her husband's a pilot?
Her husband is a pilot.
Awesome. Yeah, come
if I remember the right family.
Oh, you've got a good memory. You've got a really good memory. So
the hippocampus still works.
It still works.
Still works.
We don't know for how long, but we're happy it's still working. Well, we're ready to almost sign off. We only have 1 minute left. It's been an exciting, busy, great session, great questions, great answers from our expert. That's why He's the one that's most requested by our families, and Dr. Nelson is the one that we do the most sessions with a year, no less than 3 a year we've been doing Facebook Live, because these are very popular, and he's cutting edge, and he's also the inventor of the dynamic cooling device. So anyone who's gotten a laser where they cool your skin off, they spray it on, that's because Dr. Nelson invented it. Oh, he is a pilot, she said. So
See, it is working.
It's working.
It
Wow.
is working.
Despite what anybody says.
Yes, yes.
So Susan says if there's any more info on the Primo on arms, have you done any on the arms?
I don't know about actually, not arm. I've done more legs than arms actually. It's just the way the...
Dr. Geronimus said he is getting clearance on the arms in babies. Now, I don't know about adults, but he said he treated a baby with the arm and back and chest and got great results. So, you know what? Go for a test spot.
Yeah.
You know, that's the best news we can tell you. It's time to go. Say goodbye, Dr. Nelson. Thank you all
Happy Labor
for
Day,
your
everybody.
questions. Have a great...
Look forward to seeing you in October in California
yes,
at the conference.
And we'll see you again next month. Facebook Live will be with Dr. Drolet. Or in September, we're doing Dr. Levitin from New York. And in October, the day of the conference, the next morning, we're doing Dr. Drolet with Clove syndrome. So thank you all, and have a wonderful,
Labor Day
safe,
holiday.
and happy, and Labor Day holiday, and thank you, Dr. Nelson.
Take care.